Welcome to AI Rounds, your weekly dose of AI in medicine and education.
We are your hosts, Dr. Nuria Negrão
and Dr. Morgan Leaf. Each week, we'll bring you a quick dive into the latest in artificial intelligence and how it's transforming healthcare, medical education, and medical communications.
From the tools changing how we teach, learn, and write, to breakthroughs shaping patient care. If it's new, exciting, or just plain useful, we're talking about it.
In just 10 to 15 minutes, we'll get you up to speed and maybe even spark your next big idea.
Let's make the rounds. Welcome back to our podcast. Hi, Morgan.
Hi, Nuria. How are you?
Doing great. And I am so excited for what we're going to talk today. There's been all this buzz. We have a planning document of what we're going to talk about. And I have 6 or 7 articles
Many
on the document about the use of AI in healthcare. So I'm very excited to talk about this and to hear about your opinions on it as our resident physician. Are you ready?
I'm ready. And things are moving quickly in this area, don't you think?
Yes, very quickly. It's funny when it started, when AI came out, there were all of these doubts about will we be able to use it in healthcare? Yes, no. And then as we discussed, I think last year, as these AI scribes are coming into the clinic, clinicians in general are really, really like the AI scribes. They really enjoy being able to just let the scribe do the transcription and generate the notes and all of that, and they can focus on the patient. So we're seeing all of these articles that are really positive coming from the healthcare world. And then on the other hand, you have the patients, and we're seeing again more and more people turning to AI models to ask AI models. So ChatGPT is the new Google. Remember Google Doctor, your Dr. Google? Now it's Dr. ChatGPT or Dr. Claude or whatever. Yeah.
Absolutely.
And that is kind of one thing that I wanted to talk about today is ChatGPT and Claude both released these tools that are specific for healthcare. From what I understand, both of them. So the reason I'm saying from what I understand is that you need to get on a wait list to get access to these tools. But basically, it's ChatGPT Healthcare or Claude for Healthcare. And they have a version that is for healthcare professionals and a version for the general public. And the idea is that these tools are they go through an extra round of training specifically in healthcare materials, so they give more accurate answers when it comes to healthcare. And so talking about the public, right? The sale pitch from them is that people are asking us anyway all of these questions about healthcare, and they know because they are the owners of the models. And so we're trying to be more responsible about this. And there's obviously a need. Patients obviously feel that they're not getting the information that they want from their healthcare professionals, and they want it given to them in a different type of language. Which brings me to an example, again, from Paul Rotzer. He shared this, that last year he was noticing on his Apple Watch that his heart rate wasn't doing great. And he asked a friend of his that was a doctor, what should I do? And he said, oh, maybe you should go to the hospital. So then he went to ChatGPT. He uploaded all the data from his heart rate for the past, a few weeks to ChatGPT, had a conversation with it, whatever. And he found the conversation really helpful. And he did go to the hospital. And you go to the hospital and you have some palpitations or something like that. The joke is you're going to be popular, right? And then, so you have all these healthcare professionals coming in and out and telling you things, so that when he didn't understand what they were saying, or he didn't or they were they came in, they said something, and then they leave, and he was like, I have a question about this. He would chat with ChatGPT on his phone, and that made the whole experience much better for him. He felt calmer, and he felt like he knew what was going on because he had this companion the whole time. So now I throw it to you, my friend. What do you think about all that?
Well, I'll add, and this is, we don't need to focus on this aspect of it today, but I believe part of what ChatGPT is putting out too is something to manage your health records,
Right.
which is very appealing for
Mhm.
a lot of us these days, like go, many different places and blah, blah, blah. So I think that's an area they're delving into as well is record management. But focusing just on the Ask Dr. ChatGPT aspect, I think a few things. I think if your friend who's a doctor tells you to go to the hospital, don't second guess that with ChatGPT. Please go to the hospital. Nothing, Nuria, please don't ever do that to me. Ask me my medical advice and then believe ChatGPT over me. I strongly advise against that and always err on the side of caution. I guess if you're going to do that, take the more dramatic advice. Don't say, oh, ChatGPT says I'm fine, even though the doctor said I need to go to the hospital. Always err on the side of caution. So, with that out of the way, I think that there's a lot of really interesting layers to this. One is we're not always great as healthcare professionals, especially in an emergency, at explaining things in layman's terms that can be easily understood. So if it's addressing that flaw in the system, that's probably a good thing if it's giving good information. But that's always something that we should keep working on as healthcare professionals is how to explain things better and how to be approachable. We don't want people to feel like they have to go to ChatGPT because it's intimidating to ask us a question, or we are speaking in language that's far above what they understand, right? That's something we need to work on. What you mentioned about it being a companion, I think is really interesting. And as you're talking, I'm thinking about my husband's best friend was recently hospitalized. He had a potential large bowel obstruction and he had a surgical procedure. And for a lot of the time that he was hospitalized, he was on pain medications and stuff. And he doesn't have a spouse or like a parent nearby or a sibling or anybody who could be at the hospital with him. We're across the country from him. So he was at the hospital by himself for days. And I kept saying to my husband, like, what's going on? What and the information that I was getting secondhand was like didn't make any sense
Mhm.
at all. And his friend is a physical therapist, so he understands medical language. And it just made me realize that he was in this really vulnerable position of
Mhm.
not having somebody with him, being under the influence of the pain medications, and this idea that you could with ChatGPT, I don't know, record what the doctor says and have it explain it to you later, have a record of it, or be able to go on there and look it up and understand more. It's really valuable. So I think of course, the concern is always, is the information accurate? Where is it getting this from? That's what everybody's going to need to see the proof of that before it gets
Mhm.
endorsement from healthcare professionals. But this idea of ChatGPT being a tool that can help patients understand things, keep track of when to take their medications, right? There's a lot of people on a lot of medications. It's hard to remember when to take them. Keep track of their appointments, all these things you need to do to maintain your health. The same way our Apple Watches remind us to stand up and take a walk, and all of these things can be very helpful. If it's a tool in the toolbox that helps people maintain their health, it's great. Of course, we always want things to be equitable in the health
Mhm.
world, right? So there's always a concern. Is this going to be accessible to everyone? Is there a cost to it? Is there a technology barrier for folks who maybe aren't as adept with technology? So that those are things we absolutely have to keep in mind as this goes forward. But there's no way it's not going in that direction, right? Like fighting it would be useless. It's already there. So the idea, I think, is to perfect it and also educate the public on the limitations that it might have right now. And by the way, like ChatGPT has made some great diagnoses. I hear anecdotally from doctors all the time. Patients put their symptoms into ChatGPT. and get a very good diagnosis. Like you can't approach this conversation by poo-pooing everything that it does
Mhm.
because that's inaccurate. It can give very good diagnoses, and that can be really helpful if you're somebody with a rare disease, if you're a woman with the type of symptoms that get blown off when you go to the physician, it can be very validating to say,
Mhm.
"Hey, I put this in here. It says I have this diagnosis, and tell me more about this." It can be a very helpful tool in that way. So we don't want to just say because it is inaccurate sometimes that it's worthless. There's a lot of value in what it does right now, but we want a 0% error rate in medicine, right? So that's what we should always be aiming for, but
Mm.
I think there's a lot there, and it's a conversation worth having, and probably the most important aspect of it right now is making sure that the public understands that it's not always going to be perfect.
Yeah, I agree with you. And what you're saying reminds me of this quote. So in January, there was CES, the Consumer Electronics Show, that is always in
Yes.
January, and they show all the new cool robots. And there are like a lot of robots for healthcare. And there was a comment by Cindy Cohn. She's like the executive director of the digital rights group Electronic Frontier Foundation. And she said, I would urge people not to think that the technology is the same as a well resourced, thoughtful, research driven medical professional. And I think that kind of just like the technology is there to help us, to augment us,
Mhm.
but like a person that also has lived experience and more than just book experience also like has a lot to contribute, and that is all of our clinicians everywhere.
Absolutely. It's funny, my husband was just asking me this last night. We were talking about different medical specialties. Apparently, my niece told him that she wants to be a doctor, to which I said, "Uh-oh, let's talk, girl." And he told her very wisely that she should be a dermatologist, which I 100% agree with. And we were just talking about different medical specialties and how things are changing, where there's gonna be shortages. And I said something about radiology, and he said, "Well, aren't radiologists just gonna be replaced by AI?" I said, "No way, absolutely not." And it's important for folks to know radiology and pathology. So looking at slides is pathology, right? Are two specialties that have been using AI tools for years now, like years, like before the public even knew what AI was. And they're really helpful. They read the back. So if you're reading a chest X-ray for a patient that potentially has pneumonia, you're looking at that pneumonia, right? And maybe your eye might miss that there's a nodule in there that's lung cancer or something like that. I'm simplifying it, but these tools are being used to enhance what physicians are already doing. So they're already out there. And again, the radiologists and the pathologists are the experts who are then taking in that information and adding their expertise and their clinical knowledge and all the knowledge they've gained in their years of practice to decide which way to go with the information that the AI is giving them. So this is already out there, right? It's already being used, and I don't think it's taking anyone's job.
No.
But wow, won't it be great if it makes the system better? Because I think the
Yes.
universal answer that you'll get right now from patients and physicians is that there's so much wrong with our healthcare system.
Yeah.
And you mentioned the scribes earlier,
Mhm.
right? And
Yeah.
how that's taken a 360 in my medical career. I
Mhm.
trained, I was a medical student right at the end of the paper chart era. So I
Mhm.
learned with paper charts and sitting and talking to my patients.
Mhm.
And then we switched to computers, and there was so much to hate about that because we didn't always have our rooms set up so that we could still have that eye contact with our patients. And now we're coming back around, and
Mhm.
maybe these scribes are fixing that. We can sit down, we can have that interaction again. And so maybe AI tools as a supplement.
Mhm.
Hey, go read these articles about your lupus or whatever it is. I think
Yeah.
there's promise there.
Yeah.
Yeah.
Yeah, I totally agree with you. Thank you so much for sharing your perspective on this. I
Oh,
think this
thank
is really
you.
valuable, and I think we can leave it here. Thank you,
Okay,
Morgan.
perfect. Yeah, great topic. I'm sure we'll come back to this. It's going to
100%.
change a lot.
Yeah.
Yeah. Yeah.
All the time.
Awesome.
Okay,
Thank you.
bye.
Bye.